Hi, my name is Jenny Branigan. I'm a chartered physiotherapist at Total Physio at the Slievemore Clinic. Many women present for physiotherapy during pregnancy. There is a wide range of conditions that we treat, from carpal tunnel syndrome to sciatica, low back pain to pelvic girdle pain, cricks in the neck, rib pain, and even bladder weakness. It is very easy to ignore the aches and pains during pregnancy. A lot of people think it is just part of their condition. But in fact, there is much that can be done, and in a relatively straightforward manner, to resolve those aches and pains quickly and efficiently, and with some safe exercises from your chartered physio. So please do not linger and let the pains go on, because as the pregnancy progresses, as your bump gets bigger, you may find that these pains will get worse and worse. When you have pain, come and get a diagnosis so that we can see exactly what the cause of the problem is. We can give you some safe exercises to do in order to resolve those pains and prevent them coming back later in your pregnancy, so you can enjoy this great and unique time in your life. Now I'm going to talk about thoracic spine pain. The thoracic spine is the upper spine between the neck and the lower back. It's the area where your ribs are and where your shoulder blades are. And it's a common cause of pain in pregnancy, particularly in the later stages. The main reason for pain in the upper spine or the thoracic spine is due to posture. So as the breasts start to get larger during the pregnancy, it throws off the posture a little bit. It can make the shoulders round forwards, it can make the head poke forwards, and it can put more pressure on the upper spine. Later on in pregnancy then, as your bump starts to get bigger and bigger, the changes that result from that can also put pressure higher up in that area. And of course, as the bump expands and the rib cage starts to gradually move to accommodate that, again, that puts more pressure onto your upper spine. In some cases, people might even find that there's pain to breathe or to cough or to laugh. So it's very important to try and treat this as soon as you start to feel the pain, because as I say, as the pregnancy progresses and the breasts get larger and the bump gets bigger, certainly the pain will get worse with this type of irritation. So we can treat it very, very easily. Depending on the stage of pregnancy that you're in, we can treat you either in sitting or we can treat you in side lying. And we will often use taping to try and re-educate your posture, particularly if you're doing a lot of sitting in your job or driving. It's also very important that we mobilize into the joints, which again we can do in a very easy way, and it will be very, very good for quick resolution of your symptoms. Postural strengthening is quite an important one to counterbalance the weight of the breasts, and we can show you safe ways to strengthen those muscles there. One of the most common reasons that women present for physiotherapy during pregnancy is for low back pain. The best course of action for low back pain in pregnancy is prompt diagnosis. It is very important that you can identify the cause of the problem and resolve it as quick as possible, because unfortunately, as the pregnancy progresses, these aches and pains tend to get a lot worse. There are a few reasons for low back pain in pregnancy. The first one is the stretching of the abdominal muscles, of course, around your growing uterus. That decreases our natural body corset and it puts some pressure on the lower back. As your bump grows, you'll find that your pelvis starts to tilt more forwards. This increases what we call the lumbar lordosis, which is the natural curve in your low back. This also puts more pressure on the low back then. As your bump gets bigger and you're bending forwards with the extra weight of the bump on your lower back, again, this can be a cause of pain. In the third trimester, your ligaments will relax around the pelvis area in order to facilitate passage of the baby through the birth canal. And again, this puts more pressure on the lower back. And of course, if you've had a previous history of low back pain prior to being pregnant, such a condition like sciatica, again, this can be something that recurs in pregnancy. So my top tips for a healthy back in pregnancy include the following. Frequent changes in posture. This is probably the most important point. If you're sitting in your job, if you need to do a lot of driving for your job, even if you're sitting at home in the evening time just relaxing, it's very important not to be sitting for long periods of time. 15-20 minutes is probably enough, and at that stage then you should get up, walk around. We're not talking about a long break here, but just to change that position frequently so that your back isn't stiffening in the one posture. It's also important when you're sitting down to make sure that your hip joints are not lower than your knee joints. So basically, low sofas, bucket seats in a sports car, those type of sitting postures are going to cause a lot of problem for a pregnant person. It's important to try and watch your standing position. So if you're standing for long periods of time, remember we spoke about how the pelvis tilts forward in relation to the growing uterus. What you need to try and do is counterbalance that by tucking the tailbone between the legs to try and posteriorly pelvic tilt. What that will do is it will lengthen the lower back and will also activate your lower stomach muscles a little bit also for a bit of support, and it takes great pressure off the lower back. Try to target your leg muscles and your back muscles for strengthening. And the best way to do this actually is in the swimming pool, because the buoyancy of the water will support the weight of your growing uterus. And again, it will make your stomach muscles work a little bit more. In your third trimester in particular, make sure that you're not overstretching, make sure that you're not putting excess force through the joints to try and move them through a full range of motion. The reason for this is because of the ligament loosening that happens in relation to the hormone relaxin that's released. It's very important that you don't over push those positions, because again, you could cause a strain in the low back that way. Avoiding heels, again, very high heels in the third trimester in particular, but it's very, very important again to remember that the posture changes greatly with the weight of the growing bump and the pelvic tilt forwards. Heels are going to further accentuate that, and it closes down on your lower back by increasing the normal lumbar lordosis, as we call it, which is the normal curve in your lower back. So if you increase that curve, you're going to cause pain in your back, and heels always increase this curve, apart from the fact that they will help to change your center of gravity and make you much more likely to fall. Lifting is something to be avoided during your pregnancy at all times really, but particularly in the third trimester, again because of the effect of the ligaments loosening. A lot of women think that just because they are pregnant, they are prone to sciatica. That's not the case at all. If you have a previous history of it, then certainly it can be reactivated during pregnancy, and that's something that we need to keep an eye on you for. Again, prompt diagnosis and assessment is the most important thing here, because we need to make sure that in fact it actually is a sciatic problem rather than a pelvic girdle pain problem, which can sometimes manifest in the same way. So a sciatic nerve problem will manifest either as pain, pins and needles, or weakness down through the distribution of the nerve, and prompt diagnosis with your chartered physio is the best way forwards in that case. Now I'm going to talk about a significant obstetric problem called pelvic girdle pain, previously known as symphysis pubis dysfunction, SPD, but now referred to as PGP, pelvic girdle pain. Unfortunately, it's a recurrent problem, so again, prompt diagnosis is very important, and if you've had PGP in a previous pregnancy and you find yourself now newly pregnant, it's important to see your chartered physiotherapist as soon as possible, so that any problems or factors that would lead you prone to it again in the second pregnancy or subsequent pregnancies can be identified quickly. It's really not part of being pregnant at all, so it's very important that you treat this as soon as possible, because as the pregnancy progresses, this will get worse. And unfortunately, in some cases, it gets to the point where walking can even be difficult, and sometimes crutches are needed. So the symptoms that are part and parcel of pelvic girdle pain include the following: pain and tenderness on palpation of the pubic joint at the front, pulling or pain sensations across the lower abdomen, sharp pain into the groin area, pulling or pain sensations into the inner thigh or into the front of the thigh. It can also manifest as stiffness or pain in the mid or lower back. So there's lots of different things here that people feel generally during pregnancy, but it's very important to promptly look at these and make sure that it's not a symptom of PGP. The way that PGP manifests during people's daily life then includes getting in and out of the car, getting in and out of your bed. So any activity where the knees are widened apart from each other can cause an aggravation of symptoms. If you've been sitting for long periods of time and you get up into standing, you may find that there's pain at that stage, and also initiating walking after you've been sitting for quite a long period of time. Turning over in bed can be quite difficult with PGP. And as I say, walking can be difficult, so certainly in the later stages of pregnancy, it can get to the point where sometimes people even need to go on crutches. So prompt assessment, I cannot stress it enough. So there are a few tips that you can employ to try and avoid PGP. The first thing to try and bear in mind is to look after your sleeping position. Make sure that when you're lying on your side, put a pillow underneath your bump to make sure that you're supporting it during the night. Also have either 1 or 2 pillows between your knees inside lying. Try to walk with shorter steps, keeping the knees together a little bit more if you can. This will certainly take some of the pressure away. An ice pack will always help, but it's very important that you do it in the right way. So place an ice pack into a pillowcase so that it's not directly in contact with your skin, because otherwise you could risk an ice burn. Leave the ice pack there for only 10 minutes at a time, but you can do this, you can reapply this frequently, maybe every 1 to 2 hours, but 10 minutes maximum, and make sure it's not directly in contact with your skin. When you're standing up, make sure that the weight of your body is evenly distributed through both feet, so that you're not shifting from one side to the other, because this will cause a lot of shearing force through the joint at the front, through the pubic bone, and you'll find that this will aggravate your symptoms. The most important thing to remember with PGP is that it is certainly not part and parcel of being pregnant. The recurrence rates are very high for this, so it is very important if you have any of these symptoms to contact your chartered physiotherapist as soon as possible. Now I'm going to talk to you about neck pain. We tend to see women presenting with neck pain in the later stages of pregnancy. One of the main reasons for neck pain is all the postural changes that happen in your body throughout the pregnancy. So the first thing is the growing breasts. The weight of the breasts can pull the shoulders forwards into a rounded position. It can cause you to adopt a forward head poking chin posture. So the head comes forward like this, which puts a lot of pressure on the base of the neck where the neck meets the upper spine. Another reason for neck pain during pregnancy is tension and stress, where the muscles start to get tight. If you're worried about work, if you're worried about finishing work, if you're worried about your little toddler, or even just worried in general, a lot of women in the later stages of pregnancy will start to get tension-related neck pain. So what can we do about that? There's lots and lots of safe things that we can do with you in order to quickly resolve your symptoms. The first thing we will do is we will look at your posture. We will correct your posture according to the stage of pregnancy that you're in, and we will show you how you can do that yourself through exercise or through taping methods. We will also manually work into the area if necessary to help you adopt that better posture going forwards. Pillows are very, very important. When you're lying in the bed in the later stages of pregnancy, you'll be inside lying. It's very important that the appropriate height pillow is what you're sleeping on. So again, we can show you how your spine needs to be in neutral, how your neck needs to be in neutral when you're lying in the bed, and the pillow that you need to use in order to achieve that. A lot of women query whether they should use ice or whether they should use heat with a neck issue. If it's a sudden onset crick in the neck, ice would be more appropriate. You would place the ice in a pillowcase so that it's not directly in contact with your skin, and put it on the area for 10 minutes maximum. Alternatively, you can rub an ice cube up and down along the area, and it's very good for penetrating into the deep pain area and resolving it quickly. If you have a neck ache that's gradually coming on over a few days or a few weeks, heat would be more appropriate to use in that instance. But if you're confused, please ring your chartered physiotherapist and ask for advice as soon as possible. It's very important to deal with this quickly because, again, as the pregnancy progresses, these postural changes will continue, and it's important that you can do the safe exercises that will help to resolve this and prevent it from becoming something that will affect you as you're feeding and in the postnatal period. Rib pain can be quite a problem for women during pregnancy, particularly as they go past the 20-week mark and the bump is getting bigger and bigger. One of the main reasons for that is simply the size of the expanding bump pressing up into your rib cage, and the rib cage has to expand to accommodate for that. It's also very important that you try and maintain your lung capacity during the pregnancy, and again, as the bump starts to push up into the lung area, the ribs can find a little bit of extra pressure there. And of course, if your baby is kicking into that tender area, it's certainly going to add to the problem as well. So there are a few things that we can do in order to improve the situation here. Your chartered physiotherapist can show you some very good breathing exercises that you can do frequently during the day that will help with that rib expansion to stretch the muscles between the ribs and to take the pressure off. Frequent changes in posture is important for this type of condition because a lot of people find that sitting down makes it worse, simply because when they're sitting, the ribs compress right into the growing uterus again. So if you stand up, in a lot of cases that will relieve some of the symptoms. There are also some quite nice safe exercises from a Pilates point of view that can be employed in order to stretch this area very nicely and in a very safe way, and they can be done right up until the end of your pregnancy. Carpal tunnel syndrome is something that can affect women in the later stages of pregnancy. It manifests as a tingling or pins and needles, sometimes a burning, sometimes a weakness, sometimes a painful condition in the hand. It can be in one or both hands. The reason that it happens is that the median nerve, which is one of 3 nerves in your arm, gets compressed as it passes through the carpal tunnel in your wrist. The carpal tunnel is bordered on 3 sides by your little wrist bones, your carpal bones, and on the 4th side by a ligament. And as that median nerve passes through that tunnel, if you have a tendency to retain fluid, as a lot of pregnant women do, that fluid puts pressure on the median nerve. It's basically a trap nerve, and it causes pressure then along the distribution of the nerve into the hand. So with carpal tunnel syndrome, the symptoms tend to manifest mainly in the mornings. So you'll feel your symptoms into the hand, into the thumb, into the index finger, into the middle finger, and a little bit also into the ring finger. So there's lots of things that you can do to help the situation, but as I say, prompt diagnosis with your chartered physiotherapist is very important, so that they can help you organise your sleeping posture so that you're not sleeping with your wrist excessively in flexion. They can help you organise your pillows to maintain a nice neutral wrist posture. A stabilising wrist brace can also be used, again, to maintain this neutral posture. If you need to do lots of typing in your job, we can show you how to organise your keyboard with an ice pack in order to take the pressure off the wrists as you're working. And of course, it's important to try to avoid repetitive movements. Bladder weakness is a common complaint during pregnancy. It's something that a lot of women have experienced, but in most cases it tends to settle down after the birth, and indeed quite quickly after the birth. If you're concerned, if you have any symptoms of stress incontinence or urge incontinence and you're worried about it, please contact your chartered physiotherapist who specialises in this women's health area, because there's an awful lot of safe exercises that can be done all throughout pregnancy and in the postnatal period to help this condition. The pelvic floor exercises are something that we've all heard about and something that we should all be doing daily, but again, your chartered physiotherapist can show you how to work those muscles so that you're working them if you need to cough, if you need to laugh, or indeed just when you're going about your normal daily business. So please do not hesitate. This is something that does very commonly happen, but it's not that normal, so we need to make sure that you get prompt help for this. So it is easy to ignore the aches and pains of pregnancy and put them down to your condition. But please remember, there is much that can be done to quickly resolve your pain so that you can enjoy this unique time in your life. If any of these conditions that we spoke about are familiar to you now, if you're worried about any aches and pains that you have, please contact your chartered physiotherapist as soon as possible for a prompt diagnosis. You can get more information on our website, www.totalphysio.ie. We're located in Stillorgan on the Old Dublin Road, Total Physio at the Slievemore Clinic. Kiera and myself, we would be delighted to talk to you.